Well, good afternoon and welcome. I'm Josh Schimmels, the publisher and CEO of the Los Angeles Business Journal. It's an absolute honor to be here today hosting the 2021 Healthcare Leadership Panel and Awards. As we all know, it's an unprecedented time for healthcare professionals. And because of that, it's never been more important for us to recognize the outstanding work that they're doing on a daily basis to keep us all healthy and safe. We held this event last year, the same time frame, from the confines of our homes with great hopes that we'd be meeting in person this year. The fact that we're not only amplifies the state of the region's physical health and the continued efforts and sacrifices that have been made by our healthcare community. This afternoon, we have the opportunity to once again honor healthcare leaders on the front lines, in front offices and research facilities, labs, clinics, and hospitals. We say thank you for all that you're doing. Thank you for your time, your energy, your efforts, the innovation that you're putting in, and the constant pursuit of health excellence for us all. Let me tell you how the next hour and a half is going to break down. In just a moment, we're going to start off with a 30-minute panel discussion. We're going to engage with some of the region's most knowledgeable healthcare experts. Then we'll move into our awards programs where we'll be celebrating all that all of you are doing. We'll start with our individual awards and then we'll move into our organizational awards. I want to thank those of you who submitted questions during the registration process. We took that into consideration and you've helped us to shape today's conversation on the panel. During the discussion portion, we'll be conducting live audience poll questions. So when you see these pop up on your screen, we encourage and welcome you to respond and share your experiences with us. We'll then publish the results of those online next week on our website. Before I introduce our panelists, I'd like to acknowledge all of this year's amazing sponsors for the support of the program. We can't do it without you. First off, a very special thank you to our 5 platinum sponsors: City of Hope, LA Care Health Plan, Memorial Care Long Beach Medical Center and Miller Children's and Women's Hospital, Los Angeles, One Legacy, and Providence, Southern California. Thank you all. Also, many thanks to all of our gold sponsors: Adventist Health Glendale and Adventist Health White Memorial, Cedars-Sinai, CHA Hollywood Presbyterian Medical Center, Dignity Health Southern California, Eminent Health, Home Guardian Angels, Kaiser Permanente, Keck Medicine of USC, Kedron Community Health Center, LA Downtown Medical Center, Optum, Pacifica Hospital of the Valley, PIH Health, Pomona Valley Hospital and Medical Center, the Oncology Institute of Hope and Innovation, and UCLA Health. Thank you all so much that you do to support this program. Thank you for taking care of our community of business and our healthcare industry as a whole. Thank you so much. All right, well, let's get this started. I'd like to introduce today's speakers. Please welcome our panel of esteemed healthcare leaders. First off, John Bishop, Chief Executive Officer, Memorial Care's Long Beach Medical Center and Miller Children's and Women's Hospital, Long Beach. Kevin Manaman, Chief Executive, Providence, Southern California. Thomas Moan, Chief Executive Officer of One Legacy. Dr. Richard Seidman, Chief Medical Officer, LA Care Health Plan. Dr. Veronica Vasquez Montez, Emergency Department Medical Director, PIH Health. And today's moderator, Precious Mays, CEO and President of Pacifica Hospital of the Valley. Precious, thank you so much for being here and welcome.
Thank you, Josh, and thank you to the Los Angeles Business Journal staff for creating this annual event for healthcare leaders. I would like to express my heartfelt thanks to all the healthcare workers and leaders who have led and worked through this past year's challenges. It is an honor to moderate. Our group of extraordinary panelists who have a wealth of information. Today, they will share with you experiences with vaccination, telehealth services, organ donation, and overall impact from the pandemic. We look forward to our conversations with our panelists to hear their insights and reflections during these unprecedented times. For my first question, I would like to actually ask the entire group, what about the COVID-19 vaccine? Is it safe and does it work? Veronica, can I start with you, please?
Hi, thank you for having me. Yes, I think it's a great question, and it's a really interesting one in that we're still asking this question today, despite the preponderance of evidence that we have, and it just proves that we need to continue to educate people. We've given over 350 million doses in the United States, and if you can believe it, 4.7 billion doses worldwide. And it is safe and it works. It has been proven to reduce the rate of infection. It reduces severe illness requiring hospitalization, and most importantly, it reduces death. Now, understandably, there was a lot of hesitancy when this vaccine first came out, but this is not a new type of vaccine. We've been looking at mRNA vaccines for quite some time now. No phases of research were skipped. A lot of this was happening concurrently. And if you think about it, the entire world was working on this for a year and a half. And it came to fruition, thankfully, at a desperately needed moment in time. Two common questions that we get are about allergic reactions. Severe allergic reactions are extremely rare. You're no more likely to get an allergic reaction to the vaccine as compared with any other medication that you would be taking. And pregnancy is a really common question. But I just want to reiterate that pregnancy is a high-risk category in and of itself. The American College of Obstetricians and Gynecologists and Maternal Fetal Medicine both recommend that all pregnant patients get the vaccine. And yes, there are side effects, but they are minimal for most people. And those are body aches, site injection pain, and a low-grade temperature.
Thank you, Veronica. I appreciate that. Tom, can you give us a quick answer, please?
I have to agree 100% with Veronica in terms of the scientific proven safety of the vaccines and the efficacy. In our local experience here at One Legacy, 98% of our team has been vaccinated since somewhere about mid-March, if not earlier. And we've seen our breakthrough rate be well below the predicted 5 to 6% that were anticipated, which is a very good sign in its first point. And even those few breakthrough cases had very mild symptoms. So the vaccines are working as anticipated. They're working successfully to minimize the impact on patients and ideally on our entire healthcare system. I will add that in the land of transplantation that we work in, it's been very clear that the vaccines have been beneficial to most transplant patients, but not as beneficial due to their immunocompromised state. We're very pleased to have been working very closely with our colleagues at Johns Hopkins and others around the world in identifying the value of a booster, which has now been authorized and proposed by the CDC and the FDA and now in process. And we're beginning to see benefits for those patients as well. So I think we actually are learning something about our own benefits from boosters and look forward to the benefits to all of us.
Thank you, Tom. Kevin, can we move to you to answer this question, please?
Yeah, I think it's been answered pretty well already. The only thing I'll add is across our hospitals here in Southern California, Providence, about 90+% of the patients that are in the ICU with COVID are unvaccinated. So, even if you end up with a breakthrough case, it's unlikely that you're going to end up in any sort of critical condition. But if you are unvaccinated, we are seeing our ICUs get busier and busier. And it's really with unvaccinated patients. And like I said, it's 90+% of the patients that are in the ICU with COVID are unvaccinated.
Thank you, Kevin. I would agree. That's what we are seeing as well. So thank you for sharing that. John, can you answer that question for me as well? John?
Yes, thank you. Sorry about that. I think most of it's already been said. It's absolutely safe, and we have a very similar experience, not just in our two hospitals in Long Beach, but across our system, that more than 90% of our patients that are in the hospital were unvaccinated. And of the patients that were vaccinated, there's a significant subset that are in for other conditions and just happen to test positive for COVID or asymptomatic. And so there's no question that the vaccine is extremely effective.
Thank you, John. And Richard, could you round out this question for us, please?
Yes, happy to do so. And great answers by the other panelists. I think what I would add is that just like the pandemic itself didn't impact all people equally throughout locally and around the world, low-income communities have been disproportionately impacted. And unfortunately, there's a pretty significant gap between the overall vaccination coverage statewide and amongst Medi-Cal beneficiaries. So the state of California is reporting about 70% coverage for 12 plus having had at least one dose, but down closer to 50% for Medi-Cal beneficiaries. So it's absolutely safe and effective. While some people are still asking the question, we know the answer. It is safe and effective. We just need to continue the focus to address hesitancy and misinformation and mistrust to close that gap and make sure that everybody has equal protection as much as possible.
Thank you, Richard. I would agree that with the panelists' answers, and Richard, you mentioned it, is making sure that the mistrust out there and the information is getting out there accurately. So thank you for that. Veronica, this next question is, we are seeing some vaccine hesitancy. What is your suggestion on how to encourage vaccination and what to say to patients who come to the emergency room unvaccinated?
I think the most important thing is first trying to understand why. Every patient has a different reason for why they have yet to take the vaccine. And in my experiencing, shaming or trying to lecture people is not an effective approach. It's really trying to hear them out and understand, and then educate them based on what their reason is behind that. I think reiterating how safe the vaccine is, and again, like the other panelists mentioned, how many people who are currently hospitalized with COVID-19 and the people who are currently dying of COVID-19 are in fact, unfortunately, unvaccinated. And the last thing I try to do is just to reach out personally to them, my own experience and how difficult the past year was, seeing patients that we had a really difficult time trying to help and save and feeling that there was no end in sight, and realizing that when the vaccine came to fruition, what a difference that made. And when people come in COVID positive and are ill, it just feels like unnecessary suffering at this point.
Veronica, thank you for that. This question's for you. How has COVID affected One Legacy's working relationship with hospitals where organ donation traditionally takes place?
Very good question. Thank you, Precious. The working relationship with hospitals during COVID was challenging for everybody in the hospitals and everybody seeking healthcare. There was undoubtedly pressure on hospital ICUs to make beds available to COVID positive patients. And that prompted some understandable reductions in access for possible organ donors from county EMS agencies, which were ordered to not necessarily resuscitate people in the field where there was no way to treat them and save their lives. And it resulted in pressure on ICUs to limit the number of beds available and staff that they didn't have to manage organ donors. The fortunate thing that we've had is for the past 3.5 years, we've had an organ donor recovery center at our Redlands facility, and we doubled the capacity of our ICU there and the number of donors that we could bring to our own facility to open up beds in the ICUs for COVID patients and other patients needing intensive care services. And that took off a lot of the impact on the centers. And it, frankly, I think it also revalidated our decision to invest in creating a new, a second recovery center, which is under construction in Azusa, that will actually triple our capacity for moving donors from our own, from hospital facilities that are essentially filling their ICU beds and their staff to our own recovery center. There's actually an image behind me under construction, which I'll just add has resulted in about a 15 to 20% increase in lives saved through donation and transplantation. So a positive result from a very, very problematic circumstance for hospitals, and hopefully we help take some of the load off those hospital ICUs.
Thank you, Tom. I appreciate that. It also brings hope for those that may not have had that opportunity to have those organ donations because of the circumstances we've gone through. So thank you for the expansion and what you've shared.
Thank you.
John, this question is for you. What are some of the issues you may feel have been overlooked while battling the pandemic this last year?
I think one thing that's been overlooked is the impact that the pandemic has had on the health of our communities. So many people were fearful of getting COVID that they deferred care and put off routine visits and the preventative care that they otherwise would have got. In pediatrics, the issue, aside from kids not being exposed to illness, not being exposed to injury, is that parents are understandably very protective of their children and they have not brought them in for care that they otherwise would have gotten. And we're just now seeing an increase in our pediatric volumes, and the children are sicker than they have been in the past. And then in our adult hospital, a simple example is with respect to cancer screenings. The volume of cancer screenings was down significantly, and now we're seeing a higher incidence of cancer, and it's being caught at later stages. So that's one of the more unfortunate, amongst all the unfortunate aspects of this pandemic, and I think that is not talked about enough.
John, I appreciate that. And you bring up all of those valid situations and concerns. And I'm sure if I asked the other panelists, we could probably have another 30-minute conversation just around this topic. But due to the constraints of time, thank you for your answer. I'm going to move on to the next question for Kevin. Kevin, the question is, telehealth has transformed care delivery. How is Providence utilizing digital innovation to eliminate barriers to care?
Yeah, thanks. There's a lot going on in the space, obviously, probably for everybody on the panel. We're doing a lot on the outpatient and the inpatient side. When the pandemic first came, we flipped probably 40% of our visits were online through telehealth, which is a way to show that the healthcare industry can innovate quickly. We have a reputation of moving slow, but I think the whole industry moved very quickly. But we've built on that and certainly have been working on stuff in the past, but we're able to explode in areas like monitoring at home for, even oxygen levels, where we had patients that were in the hospital, we were able to get home and then we could monitor and then intervene if we had to bring them back in, to, monitoring people with hypertension and diabetes and being able to do interventions when we felt like people were trending in the wrong direction. And then just being able to allow people access to care when and where they want to receive it. And so we're seeing so much more on video visits for primary care, for specialty. I think that one of the great things about the pandemic, if you can say that, is that the telehealth and the ability for people to get care in the ways that they want to receive it is here and probably will not go away. And I think that's a great thing for healthcare and for our community to stay engaged in particularly around preventative care, but also on the hospital side, we're able to do so much more. And we'll see a lot more with hospital at home as we're able to utilize these technologies and be able to monitor stuff with the patients and with their family much more closely.
Thank you, Kevin. Appreciate that. Richard, this next question is for you. LA Care's membership accounts for nearly 25% of the entire population of Los Angeles County. Can you share some of your experiences and responses during the pandemic and some of the key ways?
Precious, I missed the very end of your question. I'm sorry.
Yeah, so could you share some of your experience and responses during the pandemic and some of the takeaways you have?
Yes, thank you very much. And one of the observations that we saw early on was the increase in telehealth. So I would second all of the Kevin's comments, and we too hope that those carry forward, not only at the practice and hospital level, but also plan-sponsored telehealth offerings for things such as urgent care. So we saw that utilization more than double. We also saw the utilization of our community resource platform we call LA Community Link, which is powered by Aunt Bertha behind the scenes. Queries to that resource platform increased more than 5-fold. And the most common inquiries were for food and housing. So one of the things we did was redirect grant funding to support organizations that assist with food distribution and organizations providing housing and housing support. We also saw the decrease in utilization, certainly on the outpatient side, as well as the hospital side. So one of the things we did was to accelerate payments to hospitals, because we were hearing about not only the surging demand and the pressures on the facilities. And I just want to take a moment to congratulate and thank everyone who runs a hospital or works in a hospital. Your efforts are nothing short of heroic in your efforts to meet the demands of the pandemic and finding beds and creating beds where no one might have thought many times your licensed capacity. So just an incredible response there. on the hospital side. So we advanced payments to help with cash flow there. And also with other providers in our network, we made it an advanced payment on our incentives program, which was money we were going to give out by the end of the year anyways, but we made those advanced payments to help out. So we did many other things, including extending authorization timeframes and reducing authorization requirements, facilitating transfers out of the acute care facilities into the skilled nursing facilities, and worked very, very closely with the Department of Public Health to coordinate efforts across the board. So I'll stop there. There was many other things going on, as you know, but I know we've got a lot of questions to get through.
We do. Thank you, Richard, and thank you to LA Care. They were extraordinary during extraordinary times, and we as healthcare leaders appreciate all that you've done to support us through this pandemic. And to the panelists, we're going to get through some of these questions. If you could kindly just do a little bit of some speed answers as we get through the rest of these questions so we can make it through all of them. Veronica, can you share more about the importance of wearing masks from your perspective?
Yes, this is a question that is, again, coming back into the fold, especially now as kids are going back into school. But it serves two purposes. We know that COVID-19 is primarily transmitted through respiratory droplets. So when you talk, cough, sneeze, laugh, it serves as source control for the person. We know that 50% of transmission is by people who are pre-symptomatic or asymptomatic. So we're trying to prevent that transmission from the source. And then for the person wearing the mask, it prevents inhalation of those droplets. And so by combining those two things, that's how we get community protection and it results in less transmission overall.
Thank you, Veronica. Appreciate that. Tom, this question will be for you. COVID on persons and communities of color, as well as access to vaccination and willingness to vaccinate, illustrate that economic, cultural, and trust barriers exist that harm the health of people who make up more than 50% of the region's populations. Do similar issues affect organ donation?
Absolutely. In fact, they almost parallel it exactly in terms of vaccination rates and donation rates and organ donor registration rates. So much so that a lot of our work has been about focusing on these communities of color. We'll find in the U.S. that the white multi-generational English-speaking population has donation rates as high as 85 and 90%. But communities of color run between the 50 and 75% range. So we certainly welcome all the learning that's going on about how to increase vaccination rates in communities of color. And hopefully people participating in this panel are resources we can tap into to try and learn more about to do increased donation as well.
Thank you. I appreciate the answer, and so does the panel. The next question, I'd like to ask both Kevin and John. As healthcare evolves from fee-for-service to value-based care, how do you maintain quality and accessibility? Why don't we start with you, Kevin?
All right. Well, I would argue that in value-based care models, the quality is already higher. We have a very good understanding of who has preventative screenings done, if it's mammographies, colorectal screening, immunizations, all the things that we're talking about today. We have a very good idea, or we know exactly who has gotten those preventative treatments and who hasn't. So from that standpoint, I think the quality is much greater. I think you'll see our communities actually become healthier over time. And then on the accessibility part, one of the things that we have to realize is a lot of providers are incentivized to see patients in their office because that's how they get reimbursed. And when you move to value-based care models, they get paid a certain amount to take care of that population. So they're way more motivated to do phone calls, to do increasing video visits, to build a team around them to help take care of the patient population that they're serving. So I think both quality will improve and the ability to access your physician and their team of providers that are around them will go up significantly.
Thank you, Kevin. And then go ahead, John, can you final and round out that question, please?
Yes, I think it's important to understand that value doesn't mean cheap. It's an equation with quality over cost. And through Memorial Care's over 200 sites of care, freestanding imaging, ambulatory surgery centers, physical therapy, PCP offices, urgent cares, our goal is to keep people out of the hospital by giving them timely, cost-effective care in the right venue at the right time. And I think nothing could be of more value than keeping somebody out of the hospital.
Agree. Thank you so much for those answers. Fantastic. Sure. This next question is for you. What do you see as some of the biggest challenges we face going forward?
Yeah, thank you. I think some of our biggest challenges are sustaining the focus on equity and social determinants of health. What we've seen as a result of from the pandemic is it did not affect all communities or even all facilities equally. As challenging as it was across the board, there was a disproportionate impact on low-income communities of color. There's a lot that we can do and that we really have to do, focusing on those social determinants that drive the majority of outcomes, much more that we humbly, it's a challenge to accept the reality that is much of the amazing work that we do in healthcare. So many outcomes are driven by things other than what we provide in healthcare. Lifestyle obviously is important, diet and exercise, but other factors such as poverty, education, transportation, access to food and housing. It's a terrific challenge that we have going forward, but we have to align around that, invest in communities that have traditionally been under-resourced, and we'll get better outcomes for everybody as a result.
Thank you, Richard. I'm going to jump to our last question, and we're going to call this the speed round with speed answers. So I'd like to hear from everyone. While on the road to recovery from the COVID-19 pandemic, what are some of the learnings that we can take away from the experience? Veronica.
I think from a hospital operations standpoint, we've already mentioned, Richard mentioned this, is ramping up for an unexpected increase in volume and demand in services and making sure that we had enough PPE to safely care for patients, but being creative in opening tele units and ICU space and all the things that we had to do on a daily basis and reassess. I think one of the really unexpected things was recognizing the need that we need to make sure that we're ensuring care, not just for the patients that we're looking after, but our staff and families. One of our biggest challenges was making sure that we were having timely communication with families. It's an unprecedented time. Normally, families are at the bedside, communicating directly with the nurse, directly with the care team. And you can imagine if that were your loved one, not knowing what was happening inside the hospital was really distressing, not just for patients and their families, but also for the medical staff. So really leveraging virtual visitation, figuring out how we structure daily family updates, and really, in the future, looking after our healthcare providers to see what the long-term effects of all of this will be.
Thank you, Veronica. Same question.
I'm going to have to build on Veronica's comment about the role of addressing the needs of families, especially families of the terminally ill. We were blessed by being able to allow families into our recovery center who were not able to see their loved ones as they were dying, and for very good reasons that they weren't allowed in. But we need to do a better job for families in all stages of illness, and COVID has taught us that lesson well.
I would 100% thank you for that. Kevin, can you take that question?
Yeah, I would say probably the biggest thing that I would take away is the importance of mental health and behavioral health. We were already, working on the stigma associated with that prior to COVID, but I think it has exploded significantly, not only within the workplace, but at home. I mean, people are dealing with so many different challenges in this space. And as an employer, I think it's really important that you allow this conversation to unfold in your organization and provide resources to help people handle all the sort of post-traumatic stress involved in this. I know all the healthcare organizations on this and health plans on this panel are putting a lot of work into this space for their own employees, but I just can't talk about how important that is, and removing the stigma and getting people comfortable talking about challenges in mental health and behavioral health is incredibly important. And I hope that work continues after the pandemic.
Kevin, thank you for sharing that. That would have been one of mine that I would have shared, is the mental health and that of the adolescents, the children, and the entire family unit. So thank you for sharing that. Can you go ahead and take that question?
Yes, thank you. One of the amazing things for me was the way we were able to leverage resources and the way that people work together. And we got tremendous community support and just the appreciation and gratitude that just became part of how we operated was something that it was really, for me, it was one of the most inspirational things that I've ever experienced in my career. People grew beyond whatever skill set they thought they had and worked in ways that they hadn't worked before. And so I prefer to look at it as the glass being half full, and we're a stronger organization coming out of this, and I think a stronger society in many ways.
Thank you, John. I share with my team many times that it also brought that the impossible was possible and could be possible. So thank you for that. Richard, can you answer that question?
Yes, thank you very much. And I would also just add to John and Kevin's comments as well that the new partnerships that were developed and grew throughout the course of the pandemic out of the need to do so, I'm confident those will be long lasting. And the rapid adoption of telehealth, I think it's a great example of, lots of people had lots of reasons why adoption was so slow. Patients, in some cases, were slow to adopt. Certain providers and facilities were slow to adopt. Our regulators have policies that made it harder to adopt. But that all changed in an instant. Adoption was robust. Much of it is being sustained. The regulators are coming around. So sometimes, we do have that reputation of moving slow as an industry. We have a reputation of being behind other industries. But I think another silver lining of the pandemic is, necessity being the source of creativity. We've done a lot of things during the pandemic. We have to learn to be more creative and open to change and adoption of new things.
Thank you, Richard. And thank you to all the panelists. In closing, the pandemic has definitely changed how we think and navigate as leaders during these challenging times. And as healthcare leaders, we've had the opportunity to lead our organizations through uncharted waters, to drive positive change and sustain growth with innovation and transformation. Thank you for everybody. And I will now turn it over to Josh.
Thank you so much, Precious. And of course, thank you to each of our panelists. We appreciate you sharing your expertise. While we have a large number of healthcare professionals joining us today, we also have business leaders who are looking for answers and responses. So thank you for sharing across the board from all contexts. All right, it is time for the awards. We have 7 awards for individuals and 9 awards for organizations. We're going to start by naming finalists in each category, and then we'll announce the winner. I'm also excited to share that in addition to being named as a finalist today, all of them will have expanded coverage in next week's edition of the Business Journal, so you won't want to miss that. Let's begin with our individual awards. The first category is Insurance Executive of the Year. The finalists are Tobias Kennedy, President, Montage Insurance Solutions. He has personally saved their clients millions of dollars on the premiums by bringing forth great plan designs. Thomas Means, Health and Life Insurance Specialist, PCH Benefits and Insurance Solutions. He specializes in offering a full scope of coverage and benefit solutions at competitive prices. And Martha Santana Chin, President, Medi-Cal for HealthNet. In March of 2020, she directed her team to provide access to telemedicine, interesting timing on that, for every HealthNet Medi-Cal member across the state. And our winner in this category is Martha Santana Chin with HealthNet. Martha is here with us today. We'd like to invite her to come off of mute and to say a few words. Martha, welcome and congratulations.
Thank you so much. Last year when people were understandably trying to figure out where to go buy bleach wipes or how to safely go to the grocery store, our team had the additional responsibility to make sure that HealthNet's millions of Medi-Cal enrollees also had access to the care that they needed. Where, how would they be able to go to the doctor? What services might they need? How do we find those that might fall through the cracks? And when vaccines become available, how will we make sure that vaccines get to the right populations? And because of our company's dedicated employees, because of our decades of experience in working with Medi-Cal enrollees, and because of the relationships that we built with the community, we were able to find answers to these questions. And as the state's largest commercial Medi-Cal health plan, Health Net has a special responsibility to improve the lives of millions of Californians. So thanks to our devoted team and what they do day in and day out, and thank you to the LA Business Journal for recognizing all that we accomplished last year.
Congrats, Martha. Thank you for being here. All right, to help me present the next 4 awards, please welcome back Chief Executive Kevin Banneman with Providence, Southern California. Kevin, welcome back.
Thank you, Josh. Appreciate it. The first award that I am presenting is for Trusted Advisor of the Year category. And the finalists are Adam Abramowitz and Jonathan Bluth from co-heads of healthcare for Intrepid Investment Bankers. Together, they work tirelessly to represent their clients properly and position them for transaction success. The next one is Raul Shazad, Vice President and Senior Director, Matthews Real Estate Investment Services. He is successfully blending his passion for commercial real estate and the healthcare industry. Jill Gordon, partner with Nixon Peabody. Healthcare providers and suppliers turn to her for help creating innovative products and services. And Hope Levy-Beal, partner David Wright and Tremaine. He's a practical advisor who supports innovative startups and non-traditional healthcare providers. Carol Lucas, shareholder at Batchelder. She has an extensive experience as a corporate representation of both public and private companies in the healthcare industry. And the honoree is Adam and Jonathan with Intrepid Investment Bankers. Adam and Jonathan, I know you're both with us today and would like to invite you to say a few words. Jonathan, I think we'll start with you.
Jonathan, just a reminder, you may still be on mute if you want to try again.
I am not on mute. Can y'all hear me?
Yes, we can. You're good.
Okay. Well, I'd like to thank the LABJ for honoring me and Adam Abramowitz as 2021's Trusted Advisors in Healthcare. Adam and I help lead the healthcare M&A practice within Intrepid. We're one of the largest M&A advisory firms in the Western U.S. We help our clients complete acquisitions, divestitures, private equity investments, and outright sales. And I know this has been a tough year and a half for everyone. Our team was still able to complete M&A transactions in telehealth, concierge medicine, outsourced pharma services, contract manufacturing, and aesthetics, and hopefully in the next few weeks, another very exciting physician practice deal right here in LA. One of the unique ways that we advise our clients is by regularly holding a series of special networking events that we call Medicate, during which Adam and I bring together established industry veterans with emerging executives for collaborative discussions and business development. We're proud to be trusted advisors for healthcare companies in LA and beyond. Thank you very much.
Thanks, Jonathan. I'm honored to receive the LA Business Journal's Healthcare Award as Trusted Advisor of the Year, along with my co-head of healthcare, Jonathan Bluth. This recognition is a real testament to the strong team that we built at Intrepid, along with our MUFG and Union Bank colleagues. I think we work tirelessly to bring our clients solutions for their M&A goals and growth objectives. Since co-founding Intrepid over 11 years ago, my partners and I really wanted to set out to create a differentiated advisory platform providing unbiased M&A guidance and coupled with our deep industry coverage, especially in healthcare, and really extremely proud to be leading the healthcare team here with Jonathan and what we built here at Intrepid. So once again, thanks to the LABJ and congrats to the other award recipients today. We feel an esteemed company. Thank you.
Great. Thank you, Jonathan and Adam. Appreciate that. Our next category is Outstanding Healthcare Volunteer. And the finalists are Eric Burrows, Chairman, Health and Wellness Action Group, 100 Black Men of Long Beach. He's delivered health education and resources to over 4,000 men, women, and veterans. Stephanie Chang, co-founder of Health Matters Clinic. All while doing her medical school rotations, she volunteered countless hours to cook and package healthcare kits. Manola Massell, Emergency Department volunteer, Cedars-Sinai. As volunteer programs reopened, she immediately stepped forward to take on many shifts as possible in the emergency department. Pamela Jane, CEO, Operation Scrubs. Her organization set up a permanent virtual nurses wall of gratitude for people to write thank yous. And finally, Stephanie and Sue Wilder, volunteers with USC Vertigo Hills Hospital. They've dedicated their time, talent, and financial support to ensure quality health care for over 2 decades. And the honoree is Stephen and Sue. We'd like to invite you to say a few words.
Wow, what an honor. Thank you, Kevin. And thank you to Los Angeles Business Journal. We're very appreciative.
Our journey started many years ago when my father was rushed to Verdugo Hills Hospital with congestive heart failure. And needless to say, they saved his life, which was very meaningful to me. And when I saw the kind of care he received, I immediately, upon my retirement, decided I'd go to Verdugo Hills to be an in-service volunteer, which led to a lot more involvement with the hospital and the community. And we really are appreciative of this recognition. It really means a lot for us.
You know, in today's difficult environment with the pandemic, it's really all of you, the healthcare workers, who are the real heroes in society. So it's very humbling for Sue and I to share this special moment with you. And we want to thank you for everything you have done and do and continue to do.
Thank you.
All right. Congrats, Stephen and Sue. We appreciate all that you do. Thank you. The next category is Outstanding Healthcare Innovator. And the finalists are Nene Efwa Afamanin, founder, Shared Harvest Foundation. With MyCOVID-MD, Shared Harvest provides free COVID tests and vaccine clinic pop-ups. Stephen Chen, founder and CEO of Scanwell Health. They've made it possible for lab tests to be performed at home for a very low cost. Jamie Edwards, president, CEO, and co-founder of Cloudbreak Health. They were the first to build their virtual telequarantine device to communicate to patient rooms. And Dr. Ali Gholam Razin-e-Zahad, clinical emergency radiologist and assistant professor of clinical radiology with Keck Medicine of USC. He and his colleagues continue to publish groundbreaking studies on COVID-19. And Dr. Richard Dang, assistant professor of clinical pharmacy at the University of Southern California School of Pharmacy. He played a crucial role in the implementation of LA citywide vaccination program. And the honoree is Dr. Richard Dang. We'd like to invite you to say a few words.
Hi, thank you to Los Angeles Business Journal for this honor of Outstanding Healthcare Innovator. In the last year and a half, I've had the great privilege of translating my background in pharmacy, vaccinations, and community health while working with amazing partners and collaborators from the City of Los Angeles, Mayor Garcetti's office, the Los Angeles Fire Department, CORE, Carbon Health, Curative, and USC. Through these collaborations, I have seen the heart and passion of so many people whose mission it was to help us navigate the pandemic and to increase access to life-saving vaccinations. In total, we've delivered over 1.38 million vaccinations to Angelinos, from Dodger Stadium to mobile units out in South Los Angeles. Thank you again to our amazing collaborators, and especially to the students, faculty, staff, alumni, and volunteers of the USC School of Pharmacy, whose participation was vital to our success with the City of Los Angeles program. It has truly been an experience and an honor of a lifetime. Thank you.
Thank you, Dr. Dan. Appreciate that. Congrats. Now, the last category I'll be presenting is Hospital Executive of the Year. And I hope that I'm getting most of these names right. And if I'm not throughout, I really apologize. And certainly you can rib me a little bit if I'm not getting them correct. But the finalist for Hospital Executive of the Year is Michael Caliguri, President, City of Hope National Medical Center. Dr. Caliguri has ensured access to safe care for patients at City of Hope's designated comprehensive cancer center. Grace O, Senior Vice President and General Counsel for Children's Hospital Los Angeles. She's an important advisor to both the hospital leadership and the board of directors. Darlene Scafidi, Executive Vice President of Patient Care Services at Pomona Valley Hospital Medical Center. She has over 40 years of service at Pomona Valley and began her legacy as a nurse. Graham Say, Chief Medical Officer, Memorial Care, Miller Children's and Women's Hospital, Long Beach. Throughout the pandemic, he served as a role model for the medical staff by modeling behaviors of wellness and leading open communication. And Sean Sheffield, Chief Strategy Officer, Keck Medicine of USC. She oversaw a consumer journey mapping process, identifying opportunities to improve the patient experience for telehealth. And the honoree is Sean Sheffield. Sean, please take yourself off mute and share a few words.
Good afternoon, everyone. Thanks so much, Kevin. Thank you to everyone at the Los Angeles Business Journal and our panelists today. Just feeling like an incredibly esteemed company and really proud to be here. Thank you again for this honor. I'm not sure about all of you, but certainly during this time of the pandemic, I was brought back home to me that I am so fortunate to have chosen a career not only in healthcare, but to be practicing here in Los Angeles, one of the most diverse, dynamic, and ever-evolving cities, making sure that our jobs are never dull. Obviously, this is a team sport in healthcare, so I'd first and foremost like to thank my team, who are truly the smartest, most creative, and most fun people to work with in healthcare. In fact, it doesn't feel like work with them. And a big shout out to all of my colleagues at Keck Medicine, the leadership team. I can honestly say that I've never worked anywhere that is more collaborative, respectful, supportive. And I'm so proud of everything that we've accomplished as a health system. And look out, because we've got a lot more coming. So again, thanks so much. Really a privilege and an honor to be here today.
Well, congratulations, Sean, and thank you, Kevin. I will be presenting the last two individual categories, and then we'll move into organizations. In the Hospital CEO or President of the Year category, the finalists are Elise Izai, President, Adventist Health Glendale. Under her leadership, they've expanded tremendously, allowing them to increase their reach into the community. Alina Moran, President, California Hospital Medical Center with Dignity Health California Hospital Medical Center. She's committed to focusing on population health and serving the diverse communities in the heart of downtown LA. Janice Spizo, President of UCLA Health, CEO of UCLA Hospital System, and Associate Vice Chancellor of UCLA Health Sciences. Amongst other things, she was instrumental in launching the LGBTQ Equitable Care Committee, focused on access to quality care. Robert Stone, President, CEO, and the Helen Chu Chief Executive Officer Distinguished Chair with the City of Hope. He oversees their academic research labs responsible for innovative discoveries in cancer care, as well as the organization's growing biotech operations. Paul Viviano, President and CEO of Children's Hospital Los Angeles. Under his leadership, Children's Hospital LA has grown to provide care to manage more than 600,000 patient visits annually. And the honoree is Janice Spizo with UCLA Health. Janice, please unmute and welcome to say a few words. Welcome.
Well, thank you, Josh. And let me start by thanking the Los Angeles Business Journal and the Los Angeles business community for the tremendous support they've given to us in healthcare over the past 18 months. I'm really humbled and honored to accept this award. All of my colleagues and many more are so deserving of this award for what we've really been managing over the past 2 years almost. I would like to accept it, though, on behalf of the 35,000 UCLA Health employees that work in our 4 hospitals and 200 clinics throughout the region, and for their dedication to serving our community throughout this time. It's really their work and inspiration that allows UCLA to really achieve the success that it's had, and it's just a privilege for me to serve. I'd also like to thank them as well for their work on quality, safety, service, and improving outcomes this past year during the most difficult time that allowed us to once again achieve the U.S. News and World Report ranking of #1 in California, and for the first time, jumping ahead of Johns Hopkins to #3 in the nation. That was really the work of our team. And I'm grateful and humbled. I would also like to thank the amazing group of Los Angeles healthcare executives that work together every day during this pandemic to make sure our patients are safe in our community. Thank you.
Congratulations, Janice, and thank you so much for being here. Also, congratulations on those recent accolades as well. Our final individual award is for Health System Executive of the Year. Our finalists are Rob Curry, CEO of Eminent Health. He has more than 40 years of hospital leadership and continues to expand access to care and address healthcare disparities. Dr. Amar Desai, President and CEO of Optum. He oversees care delivery, which is comprised of more than 20,000 physicians serving nearly 2.5 million patients. Dr. Barbara Ferrer, Director, County of Los Angeles Department of Public Health. Dr. Ferrer has continued to show her unwavering commitment to science and public health, even in the face of adversity. Felipe Osorno, Executive Administrator of Continuum of Care, Operations, and Value Improvement with Keck Medicine of USC. He and his team work to create a smooth and efficient delivery of COVID vaccines to staff, patients, and to the community. And finally, Eric Wexler, President, Operations and Strategy for Providence. He drove weekly to Providence's hardest hit hospitals to deliver critical supplies and volunteer for 8-hour shifts. The honoree in this category is Rob Curry, CEO of Eminent Health. Rob, welcome. Thanks for being here and congratulations.
Josh, I thank you for that kind introduction, and I'm both humbled and honored to receive this recognition and thankful to the Los Angeles Business Journal. I want to start by thanking and recognizing the incredible level of talent of the team I am blessed to work with, from the board to physician leaders to my executives and our leadership teams. They have proven themselves just to be phenomenal individuals and outstanding leaders. You know, since my interview approximately 14 years ago until this very moment, I have totally enjoyed serving Eminent Health. It's been a truly mission-driven and values-based system that helps a very vulnerable population. I have witnessed our bond ratings go from a double B minus, by B minus, a junk bond, if you will, with a poor outlook upon my arrival, to now having an A+ rating with a stable outlook. I have watched us grow in developing centers of excellence in cardiology and women's health and neurology, orthopedics and emergency care, and we will be developing one in oncology very soon. We have worked with the Joint Commission Center for Transforming Healthcare in pursuit of highly reliable care, seeking zero harm within our facilities. These past 18 months, I couldn't be more proud of our response to COVID-19 as we kept both staff and patients safe, and again, with a very, very compassionate, tender touch. During the remainder of 2021 and 22, I look forward to the investment of approximately $300 million in new construction and renovation of our facilities here in San Gabriel Valley. And finally, to thank the 3,600 employees who work at Eminent for providing quality and compassionate care, and for voting us on the Glassdoor recognition as the #1 healthcare provider for the best place to work in the nation. So again, I thank you, the Business Journal, for this recognition. I offer my sincere congratulations to my fellow nominees, and I thank my family for their support.
Thank you, Rob, and congratulations to the entire team there at Eminent. We appreciate you being here. Well, let's give a round of applause for our individual finalists and all of our honorees. Congratulations to each and every one of you. Now we're going to be shifting and presenting our organizational awards. The first is for Best Home Care Program. The finalists are 24-Hour Home Care. They developed their program Safer at Home and have provided over 70,000 hours of COVID care. Home Guardian Angels. During the height of the pandemic, they grew from 100 to 600 caretakers in order to support their volume of clients. Team Select Home Care. They've been advocating for the Family CNA program that allows parents of medically fragile children to become certified caregivers at no cost to them or to the state. And our honoree in this category is Home Guardian Angels. Mark Adderley, their Chief Operating Officer, is here with us. Mark, we invite you to unmute and please say a few words. Welcome.
Thank you, everyone. Can you see me?
Yes, we can.
Wonderful. We would first like to thank Los Angeles Business Journal for just recognizing the work that we're currently doing. And of course, we're extremely honored to be recognized and nominated and actually win this because we're familiar with a lot of the other people in the organization. And again, humbled for what we do. We started this journey about 8 years ago, dealing with our own personal trials and tribulations of trying to provide home care in the inner city and in the lower income parts of our own family. And instead of complaining about it, we decided to create that company to be the company that we couldn't find at the time. And with the support of some incredible partners and government organizations, we were able to educate, we were able to train and reinvest in the community to help themselves. And fast forward 5+ years, COVID-19 hit us all. And as we were all trying to navigate this thing, the government came to us to say, could we do more inside the inner cities and the minority communities that were being affected by COVID at another level? And with our unique approach of reinvesting in the community and actually training these same people that lived in that community, we're honored to say that we were able to help over 600 families over the last 18 months and allow quite a few essential workers to continue to work and provide those essential services to keep us safe. So we also want to thank our incredible staff, our admin staff, our management staff, and the hundreds of caregivers throughout the inner city and minority communities providing this essential work to allow us to hopefully get back to normal sometime soon. So we thank you again. We're humbled, we're appreciative, and we thank Los Angeles Business Journal for taking the time out during these trying times just to give a little recognition for people doing some incredible work. So thank you again.
Mark, congratulations. Thank you for being here and congrats to the entire team at HGA. All right, our next award is for Best New Product or Service. The finalists are Cedars-Sinai. Their COVID-19 recovery program helps patients cope with their lingering shortness of breath, dizziness, brain fog, headaches, anxiety, depression, and loss of taste or smell. Scanwell Health. They turn the smartphone into a clinical lab. Their COVID tests are taken at home and patients receive results in minutes. USC Verdugo Hills Hospital Community Resource Center for Aging. Their center aims to improve the quality of life for older adults with a broad network of support services. Our winner in this category is Cedars-Sinai. Dr. Catherine Lay, co-director of the COVID-19 recovery program, is here with us today. Dr. Lay, thanks for being here.
Thank you so much for having me, and thank you to the LA Business Journal for this recognition. As one of the co-directors of the COVID-19 recovery program here at Cedars-Sinai Medical Center, I'm really honored to accept this award on behalf of my very large team at Cedars. And, just to quickly summarize, our program was created late last year to provide a comprehensive consultative evaluation for patients who are experiencing persistent symptoms or long COVID symptoms following COVID infection. And we're really one of the few specialized and multidisciplinary programs of this type in the state and really in the country. And we've seen about 400 patients from all over the country and even from outside the US at this point. It's definitely taken a village to establish this program. And this includes all of the leadership at Cedars-Sinai that have really supported us from the beginning when this was just an idea on a 2-page Word document, to the research team, office managers, and all the support staff that really makes the day-to-day functioning of the program possible. And of course, I wanted to give a huge thank you to all of our doctors who are seeing patients day in and day out. It really hasn't been easy, and it's been an additional responsibility on our plates in addition to being frontline healthcare workers during the pandemic. And so my appreciation for this really can't be overstated. It's been a really hard year for all of us, but we are very proud to be able to provide this much needed service to our community. And on that note, I'd like to use this opportunity to echo what our panelists have said before and remind everyone that your medical community, nurses, doctors, and your general community are really depending on you to protect yourself and get vaccinated with any of the currently approved vaccines out there, which, as mentioned, are very safe, very effective, and really a part of each of our individual responsibilities so that we can end this pandemic and get back to our lives. Thank you again for this honor.
Thank you for being here, Dr. Lee, and congratulations to the Cedars-Sinai team. Our next category is for Educational or Institutional Program of the Year. Our finalists are Children's Hospital Los Angeles. They implemented a training program to help its Care Network pediatricians better serve patients struggling with mental health. David Geffen's School of Medicine at UCLA. Their initiative, Cultural North Star, helped build and maintain an inclusive culture by mapping decisions, actions, and interactions to a shared framework. Providence, their Community Health Worker Training Academy, created a well-paying jobs situation for people in underserved communities. And our honoree is Providence. Justin Joe, their Director of Community Health Investment, is here with us today. Justin, welcome. Please say a few words. Congratulations.
Thank you, Josh, and thank you to the Los Angeles Business Journal for this honor in recognizing the Providence Charles Drew University Community Health Worker Academy. On behalf of Providence, I'm deeply honored to accept this award. This program is truly a collaborative effort, and I want to recognize the leaders and staff at Providence, Jim Tehan, Juan Mendez, and Rosie Salazar, and our key partners at Charles Drew University, Dr. Hector Balcazar, Dr. Sheba George, and Lucero Silva, who came together to bring the Community Health Worker Academy to life. And I would also like to thank the California Governor's Office of Business and Economic Development for the grant funding that enabled us to train our first 2 cohorts of interns. The Community Health Worker Academy is a workforce development program designed to integrate community health workers into hospital and clinic settings. It's a paid 6-month internship that consists of 5 weeks of standards-based curriculum taught by the instructors at Charles Drew, followed by 21 weeks of on-the-job training in healthcare organizations throughout LA. And these internship sites include our 6 Providence hospitals in LA, Cedars-Sinai, Dignity Health, Northridge Medical Center, and community clinics such as Harbor Community Health Center, San Fernando Community Health Center, and Westside Family Health Center. During the on-site job training, interns receive one-on-one job coaching and mentorship from Providence and continuing education from Charles Drew. Providence also provides ongoing technical assistance to the clinics and hospitals to successfully integrate community health workers into their health teams. This community health workers are valuable members of clinical care teams who serve as familiar, trustworthy sources of help for the populations they serve. And in light of the COVID-19 pandemic and the ever-increasing myths and misinformation, it's even more imperative that we build a workforce of trusted individuals that bridge the gap between our healthcare institutions and those in our most vulnerable communities. And so we know that the Academy will help our community health worker interns attain future jobs through the skill development and connections to employers. And at the same time, the interns are improving patient health by guiding them to much needed medical care and resources. We're really proud to be creating a pipeline of community health workers to strengthen our healthcare system in LA. So thank you again for recognizing the value of the Academy with this award.
Thank you so much, Justin, and congratulations to the Providence team. All right, we're down to our final 5 awards. Our next category is for Outstanding Community Outreach. The finalists are Communities Lifting Communities. They've launched programs such as Cherished Futures for Black Moms and Babies and Diabetes Prevention and Food Security. Kaiser Permanente, Southern California. They leverage their partnership with the LA Football Club to educate on COVID-19 safety and vaccines. Los Angeles City Employees Retirement System. They have developed a program called Lacers Well that integrates social media, emails, and seminars for their 20,000 retired members. COVID-19 Pandemic Research Center, Keck School of Medicine of USC. Their Stay Connected LA campaign worked with 11 East LA artists to develop culturally grounded public health messages. The Wall Las Memorias. They currently provide health prevention and awareness programs in the fields of HIV, hepatitis C, substance misuse, and mental health. And the honoree is Communities Lifting Communities. Their president, Susan Harrington, is with us today. Susan, welcome and congratulations.
Thank you, Josh, and thank you to the Los Angeles Business Journal for honoring Communities Lifting Communities as an outstanding community outreach. Communities Lifting Communities was founded in 2017 as an affiliate organization of the Hospital Association of Southern California and leads various initiatives to improve community health and reduce health inequities across Southern California. Our initiatives include those that Josh mentioned: Cherish Futures for Black Moms and Babies in Los Angeles County, preventing diabetes by addressing food insecurity projects, and healthcare leadership engagement, collaboration, and education programs to advance health equity and improve population health. This award is important to us because it recognizes the Communities Lifting Communities team, the hospitals and health systems that we work with, the community advisors, and our many partners, including the Public Health Alliance of Southern California and the Center to Advance Community Health and Equity, among others. Thank you again to the LA Business Journal for this award.
Congratulations, and thank you so much for all that you're doing in the community. Our next award is for outstanding collaboration, and I'll tell you, having read every single nomination that was submitted, this may have been my favorite personal category, just to see the work being done, the collaboration, the innovation, and just all the efforts I thought was fascinating. So I think you'll enjoy it as well. Our finalists in this category are BetterTogether.Health with Cedars-Sinai, Dignity Health, Southern California, UCLA Health, Providence, and Keck Medicine of USC. These 5 healthcare systems have been united for 16 months to jointly participate in a massive public service educational campaign. The City of Los Angeles COVID-19 Communities Lifting Communities Vaccination Program, Carbon Health, Community Organized Relief Effort, Curative, and USC School of Pharmacy. The collaborative created mass vaccine sites in LA's hardest hit neighborhoods to help these underserved communities. The Rosalind and Arthur Gilbert Foundation and Family Caregiver Alliance. They created and funded an annual awards program recognizing organizations leading the way for Alzheimer's caregivers. Stand Up to Cancer and Exact Sciences. The partnership aimed at improving cancer screening, diagnostic testing, early detection, and prevention. COVID-19 Pandemic Research Center, Keck School of Medicine of USC, Los Angeles County Department of Public Health, USC Sol Price School of Public Policy, and USC Schaefer Center for Health Policy and Economics. This collaborative study follows up to 3,000 county residents to better understand social inequities exposed by COVID-19. And the honoree is BetterTogether.Health. With us today is Rhoda Weiss, founder and chair of BetterTogether.Health and representing all 5 healthcare systems. Rhoda, we'd like to welcome you to say a few words. Thank you for being here and congratulations.
Thanks so much. We're really excited about getting this award. In March of last year, many of us became concerned that COVID would not only result in a pandemic, but also a public health crisis, people going without important medical care for illnesses and injuries. We feared an epidemic of late-stage cancers, advanced heart disease, debilitating strokes, injuries not attended to, kids not getting vaccinated, and much more. So we did something that was highly improbable. We united LA's largest, most competitive nonprofit health systems in a mission to encourage Angelenos to put health first and access care when needed. Each diverted resources to launch a giant multi-channel public service campaign showing empty beaches and highways, saying life may be on pause, your health isn't. Thanks, LA, for doing your part. Get care when you need it. We are not done. Our BetterTogether.Health, Cedars-Sinai, Dignity Health, Keck Medicine of USC, Providence, and UCLA Health are launching an even bigger campaign of Get Back to Your Doctor, Your Health, Your Joy, because we love a healthy LA. You'll see it on billboards, buses, stadiums, concerts, and print, digital, social radio, many languages, and heart-stopping public service TV message of 10 people who, because they access timely care, They are back to the things they love. Thanks, Vince Scully and Kareem Abdul-Jabbar for our voiceovers, our composers and production and media that carry our message. Kareem sharing his winning battle against leukemia and prostate cancer. Our MMA fighter back sparring and training after timely stroke care. Our baseball player who fought testicular cancer, now battles major league pitchers. Mom fighting COVID during pregnancy, delivered healthy triplets. An artist with breast cancer back painting. A priest tested early, beating lung cancer. A champion athlete surviving stage 4 cancer. A couple diagnosed with bladder cancer and heart disease a month back performing concerts. A child adopted from China who couldn't walk, becoming a recent NCAA champion gymnast, and a young teen who fought leukemia starting at age 4, swims competitively, and wants to be a pediatric oncologist because he knows what it's like. Our hundreds of thousands of healthcare heroes who care 24/7 for our communities all want you and those you love to get back to your doctor, your screenings, your health, your joy. Get vaccinated, wear a mask, join our campaign because we love a healthy LA. On behalf of the chief marketing officers who spent countless hours working with me to make this happen, Gina Reddick, Patty Kuhn, Jennifer Fagnani, Lynn McMaster, Tanya Andreadis, our CEOs, Janice Spizo, Tom Prisolak, Rod Hammers, Julie Sprengel, Eric Wexler, who enthusiastically continue to endorse this because we all love a healthy LA and we love the Los Angeles Business Journal. And thank you for this great honor.
Thank you, Rhoda. Congratulations really to all of you. As I mentioned, going into that category, it was probably my favorite just from a reading standpoint to have the opportunity to learn about so many wonderful things happening in our communities and with our systems. So congratulations and thank you all in that category, all of our finalists and our nominees as well. Just amazing. All right, to announce our final 3 awards, please welcome back Tom Moan, CEO of One Legacy. Tom, welcome.
Thank you very much, Josh. The first category I'm going to present is Community Clinic of the Year, and the finalists are Airport Marina Counseling Service. Their telehealth model kept clients connected with their therapists at a time when they needed them most. Curtin Community Health Center. They set up mobile vaccine clinics to bring the vaccines directly to the community. The Oncology Institute of Hope and Innovation. Their unique, comprehensive approach to cancer care leads to positive outcomes and happier patients. And the honoree is the Oncology Institute of Hope and Innovation, and their CEO, Brad Hively, is with us today. Brad?
Thanks, Tom. It's a real honor to be receiving this award and recognized among this incredible group of awardees and nominees. And thank you to the LA Business Journal for this recognition. For those of you who don't know the Oncology Institute, we call ourselves TOI. We're the largest community oncology group in California, and we're the nation's leading value-based oncology group. So at TOI, we believe that every patient deserves access to world-class cancer care closer to home. We were founded in 2007 with the belief that there's a better way to provide cancer care, one that's grounded in quality outcomes rather than the amount of care that's delivered. And since then, we've served more than 150,000 patients. We've expanded to 4 states. We're about to open our 50th clinic. We've enrolled thousands of patients in life-saving clinical trials, and we were the first community-based practice on the West Coast to provide outpatient stem cell transplants. We continue to innovate every day, helping guide our patients through what is often the most difficult experience of their lives. And lastly, we're excited to become Los Angeles' newest publicly traded company when we complete our previously announced go public transaction later this year. So I'm really proud to receive this award on behalf of all of our doctors and nurses and healthcare workers here at TOI. Thank you very much.
Congratulations again, Brad, to you and your teams. The next category is Top COVID-19 Research Organization. And the finalists are Cedars-Sinai. Their researchers have conducted over 100 studies, including clinical trials of new therapies. Children's Hospital Los Angeles. They've led research on more than 17 studies on COVID in children. COVID-19 Pandemic Research Center at Keck School of Medicine of USC. Their center has initiated and collaborated on more than a dozen far-reaching studies. And the honoree is Children's Hospital Los Angeles, and here with us today is President and CEO Paul Viviano. Paul?
Thank you so much, Tom, and good afternoon, everyone. Thanks for this consideration on behalf of Children's Hospital Los Angeles. Thank you to the LA Business Journal for honoring our organization in this really deeply and meaningful way. In February 2020, as the novel coronavirus was just making its way through Italy and the Middle East, Children's Hospital Los Angeles Department of Pathology and Laboratory Medicine recognized that a global pandemic was not only likely, but imminent. The Children's Hospital Los Angeles Virology Lab team began developing the supply lines and workflow needed to implement in-house testing for COVID-19. As a result, by the time the global pandemic was declared a month later, the CHLA lab had received CDC and FDA formal approvals and were fully stocked with the swabs, collection tubes, reagents, and everything else needed to test team members and our young patients for COVID-19. Within weeks, the lab team had procedure down to a 6-hour turnaround time for results. Children's Hospital Los Angeles was asked by several local institutions to supplement testing services for those who needed more capacity. I share this example not because it is an outlier, but rather because it is typical of the scientific expertise, leadership, foresight, common sense, and presence of mind that Children's Hospital of Los Angeles children's researchers and laboratory teams bring to their work every day. The CHLA research teams have sequenced the genomes of every single patient who tested positive, literally thousands of coronavirus samples, which in turn allows CHLA to play a key role in filling a knowledge gap about how the disease spreads in both children and adults. Bottom line, the research they are doing to saving lives and making our world safer. Children's Hospital Los Angeles has led more than 17 externally funded studies on COVID-19, including one of the largest U.S. genetic studies of COVID-19 in children that supported public health decisions limiting contact. The only COVID-19 study looking at immunocompromised children and how prolonged infection increases risk of mutations. And research on when saliva can be used as a reliable testing method for COVID-19, making testing more accessible for all people. I would like to acknowledge those who helped make this award possible, pathologist in chief, Dr. Alex Judkins, who heads the CHLA Department of Pathology, Laboratory Medicine, and is the executive director of the CHLA Center for Personalized Medicine, and our chief scientific officer, Dr. Pat Levitt. I would specifically like to recognize the incredible leadership of Drs. Jennifer Deanne Bard, Joao Guy, and Maurice Mo Gorman, who worked together to develop and deploy the COVID-19 testing, sequencing, and serological analysis tools that have allowed CHLA to make these important research contributions. This work has been performed by the entire microbiology and virology lab and Center for Personalized Medicine teams. It has been supported by efforts of the faculty across the entire Department of Pathology and Laboratory Medicine. Today, I'm proud to recognize and congratulate the stellar scientists and clinical research at Children's Hospital Los Angeles, and I'm even more proud to accept this award on behalf of CHLA. Thank you very much.
Paul, thank you very much. Thank you, the entire team. We all owe you a tremendous debt for this work at the front end and front lines of COVID-19. Next up, we have the exceptional COVID-19 vaccine rollout initiative. The finalists are Dignity Health Southern California. In early 2021, they joined forces with AEG, LA Galaxy, the city of Carson, to vaccinate over 20,000 people at the Dignity Health Sports Park. Kaiser Permanente, Southern California. They've administered vaccines at community pop-ups and in partnerships with the LA Football Club. Keck Medicine of USC. By the end of June, they had administered close to 90,000 doses of vaccine. LA Care Health Plan. LA Health Plan and Blue Shield of California quickly mobilized to launch free vaccine clinics in high-need areas. UCLA Health, they provided patients with access to their COVID-19 digital vaccine record through their patient portal. And the honoree is Kaiser Permanente, Southern California, and Bill Caswell, Senior Vice President and Chief Operations Officer, has joined us. Bill, would you like to say a few words?
Great. Thank you, Tom, and our personal thanks to the LA Business Journal for this outstanding recognition and award. I think the LA Business Journal in this event needs to recognize that perhaps one of the greatest lessons over the last 2 years has been the coming together of the healthcare community, and to recognize Martha Sanchez Chin, Steve and Sue Wilder, UCLA, Emanate, USC, Keck, Providence, Dignity Health, and all of our colleagues that have come forward and established their role not only as a healthcare provider, but as a corporate citizen. So on behalf of Kaiser Permanente, this is an exciting day to recognize some amazing work. And it started again 2 years ago when so many of us were challenged to provide testing. And within 90 days, we tripled the capacity within Kaiser Permanente to deliver not only employees and healthcare workers, but to those needed critical care workers throughout all of Southern California. And then it was a landmark day on December 14th, 2020. And it's thought that to whom much is given, much is expected. And that was the first day in Los Angeles County where a COVID vaccine was given to an individual. And the amount of hope and the savings of lives and the news media. And as I got my shots and all of you hopefully have gotten your shots, it created a different expectation of what the world could be in a pandemic and how we could move forward together. So over the last 9 months, Kaiser Permanente has delivered over 3 million vaccines throughout Southern California, many of those to non-members. And we are excited to say in this recognition from the LA Business Journal that it is that continued commitment from everyone on this call and all of our healthcare colleagues and the stand that public officials have taken and the shout out that we need to have vaccinations as employees in the workplace, healthcare and beyond. That's the meaningful takeaway for today. And our work is not done. So Kaiser Permanente continues to enter underserved communities. We continue to outreach to those that are vulnerable and need the vaccines because we know it's the right thing. And I know each of you share with me the opportunity to continue that mission. So again, thank you, Tom. And on behalf of Kaiser Permanente, we are grateful.
Bill, thank you very much. And for the final award of today's programs, we have the top hospital or medical center. The finalists are Cedars-Sinai. Over 100 community partners received $25 million in funding from Cedars-Sinai to advance access to care. Children's Hospital Los Angeles. They vaccinated thousands of child care workers and teachers at churches and schools in underserved communities. City of Hope. They're developing and manufacturing over 80 new drugs and conducting their own clinical trials. Keck Medical Center of USC. Their telehealth visits tripled in the past year and are expecting to complete more than 150,000 sessions. UCLA Health, their clinical labs are among the first in the country to develop in-house COVID testing with result delivery within hours opposed to days. And the honoree is City of Hope. Vince Jensen, their interim chief clinical operations officer, is joining us today. Vince, we'd welcome you to unmute.
Great. Thank you, Tom. It's my honor to be here with all of you and to accept this award on behalf of our leadership, our physicians, our staff, and our scientists. City of Hope has been delivering care for more than a century, combining our scientific discoveries with new leading edge treatments to prevent, treat, and ultimately to cure cancer. Our focus is to bring tomorrow's discoveries to patients who need them today. Since 1913, our model of care has focused on the whole patient and the family, physically and both emotionally. We often say when we take the hand of a patient, we don't let go. We're honored to be recognized for City of Hope's commitment to our patients and communities, particularly during the pandemic. Thank you to the many caregivers at City of Hope who have worked so diligently to deliver care with remarkable skill, empathy, and compassion. I want to congratulate all the honorees here today. It was a remarkable event, and thank the Los Angeles Business Journal for recognizing City of Hope as the top hospital of the year. Thank you.
Congratulations to City of Hope. Congratulations to all of our nominees, all of our finalists, and of course, this year's winners. Thank you to each of our panelists, and thank you, Precious, for moderating. This has just been an incredible afternoon. We are surrounded by a very, very talented and an amazing healthcare community. I want to thank all of you for all that you do for all of us. I want to remind you that Monday's print and digital versions of the LA Business Journal, we're going to highlight the event. Additionally, if there's people that friends, colleagues, family members who weren't able to join today, but you think would enjoy watching this. You can view it in its entirety on labusinessjournal.com beginning Monday. We look forward to hosting you next year. Knock on wood. Hopefully that'll be in person. If not, we'll do it again virtually, but we will continue to honor all of you. Thank you and have a wonderful day.